Speech and language impairment. Speech and language impairment, a communication disorder that adversely affects the child's ability to talk, understand, read, and write. This disability category can be divided into two groups, which is speech impairment and language impairment. So, dito sa speech and language impairment, this is a communication disorder that the child's ability to talk, understand, and read, write, yon naapektuhan nung speech and language impairment yung mga ability ng isang bata kung saan nahihirapan silang magsalita, umintindi, magbasa at magsulat pag meron silang speech and language impairment. There are 3 types of speech impairment and 5 types of language impairment, which is in speech impairment there are articulation disorder, fluency disorder, voice disorder, and for language impairment there are phonological disorder, morphological disorder, semantic disorder, syntactical deficit, and last but not the least, the pragmatic difficulties. The first type of speech impairment is articulation disorder, are the errors in the production of speech sounds that may be related to anatomical or physiological limitation in skeletal, muscular, or neuromuscular support for speech production. This disorder includes omissions, submissions, distortions, which is omissions. There are words that the child cannot utter it by word. Instead of both, they say it's boo. Kaya natatanggal yung mga mahirap na words na hindi nila masabi. And for submission naman, napapalitan yung word na dapat bigkasin nila sa ibang letter na instead of rabbit, nagiging wabbit. Pero meron napapansin natin sa mga batang papasalita pa lang, meron yung mga bata na nagsasabi na nabubulol sila sa R tsaka sa W. And yun, normal lang yun. Kasi pag tanda, pwede naman yun mabago. Pero pag siya, hindi pa rin nabago yung ganun na paraan na pagsasalita niya, meron na siyang speech impairment. Distortion, instead of sip, nadadagdagan siya, nagiging slip na siya. Kaya meron din yung mga bata na dadagdagan yung mga word na dapat nilang sabihin. The second type of speech impairment is fluency disorder, are difficulties with the rhythm and timing of speech, characterized by hesitations, repetitions, or prolongations of sounds, syllables, words, or phrases. Common fluency disorder includes stuttering, a rapid-fire repetitions of consonants or vowel sounds, especially at the beginning of words, prolongations, hesitations, interjections, and complete verbal blocks. Number 2, cluttering, excessive fast and jerky speech. The number 3 type of disorder is voice disorder, are problems with the quality of use of one's voice resulting from disorder in the larynx, are characterized by abnormal production and or absences of vocal quality, pitch, loudness, resonance, and or duration. So, sa voice disorder naman, Pag nasobrahan natin uminom ng malamig na tubig, na aapektuhan yung throat natin. Kaya magkakos siya ng anong tawag dito, yung pagkawala ng boses, kaya nasisira yung ating throat. Ito naman yung mga types of language impairment. The number one type of language impairment is phonological disorder. Phonological disorder defined as the abnormal organization of the phonological system or a significant deficit in speech production or representation. So, sa phonological disorder, a child with phonological disorder may be described as hard to understand or as not saying the sounds correctly. And one of example of this is aprasia. Aprasia is specific phonological disorder where the student may want to speak but has difficult planning what to say and motor movement to use. The number two type of language impairment is morphological disorder, defined as difficulty with morphological inflections on nouns, verbs, adjectives, and signals different from meanings. The number three type of language impairment is semantic disorder, are characterized by poor vocabulary development inappropriate with the word meanings, and or inability to comprehend word meanings. This student will demonstrate restrictions in word meanings, difficult with multiple or word meanings excessively used to non-specific term like thing or stop, and definitely references like and that ender. So, in syntactical deficit, are characterized by difficulty in acquiring the rules that govern words, order, and other aspects of grammar, such as subject, verb agreement. Typically, excuse me, this student produce shorter and less elaborate sentences with fewer cohesive conjunction than peers. So, in pragmatic difficulties, there are characterized as problems in understanding and using language in different social contexts. This student may lack an understanding of rules for making eye contact, respecting personal space, requesting information, and introducing topics. And let's proceed to symptoms of speech disorder. Repeating sounds, adding extra sounds and words, elongation words, making jerky movements while talking, blinking several times while talking, visible frustrations when trying to communicate, taking frequent pauses when talking, distortion sounds when talking, or hoarseness or speaking with raspy or gravelly sounds voice. Repeating sounds, yung mga paulit-ulit nilang binibigkas. Adding extra sounds or words, yung may mga ganon, yung elongating words, papahabain nila yung mga words na dapat maiksi lang, making jerky movements while talking, galaw ng galaw, blinking several times while talking, yung mata pag Yung mata pag nagsasalita laging kumukurap. Visible frustrations when trying to communicate. Kinakabahan pag may kausap na iba. Taking frequent pauses when talking, pahinto-hinto, distortion sounds when talking, yung may ibang words na nasasabi, hoarseness or speaking with raspy or gravelly sounding voice, yung may garagal sa pagsasalita. Sila yung may mga symptoms ng speech disorder. Symptoms of language disorder naman ay yung mga does not smile or interact with others, birth and older. Yung mga malimit lang ngumiti o makikihalubilo sa iba, does not babble, hindi sila masayahin, makes only a few sounds or gesture like pointing, yung malimit na gumalaw, yung tuturo lang niya yung gusto niya, ganon, does not understand what others say, mahirap umintindi. Sabi ko nga kanina na ang speech and language disorder impairment ay mahirap makicommunicate sa ibang tao. Says only few words, maliit lang yung kaya nilang bigkasin. Words are not easily understood. Mahirap silang umintindi ng mga salita na mahirap sabihin. Does not put words together to make sentence. Has trouble playing and talking with other children. Nahihirapan makilaro sa iba, tsaka makikausap sa iba o kumausap ng ibang bata. Has trouble with early reading and writing skills. So, nabanggit ko nga naman ulit kanina, 'di ba, na mahirap silang magbasa, magsulat, makicommunicate sa ibang tao. Yan ang mga symptoms ng language disorder and speech disorder. Ang mga cause of speech disorder are vocal cord damage na nasisira na yung vocal cord nila. Kaya hindi na sila makasalita ng maayos. Brain damage, pati utak, muscle weaknesses, nagiging mahina na yung mga muscles nila, respiratory weaknesses, yung sa may lungs naman nila na parang nahirapan na silang huminga, stroke, polyps or nodules with vocal cords. Pag sinabi natin polyps, ang polyps ay abnormal polyps. Polyps are abnormal tissue growths that most often look like small flat bumps or tiny mushroom-like stalks. Most polyps are small and less than half an inch wide. Polyps in the colon are the most common, but it's also possible to develop polyps in place that includes ear canal. So, nodules. Ang nodules naman ay is the growth of abnormal tissue. Nodules can develop below the skin. They also develop in deeper skin tissues or internal organs. Dermatologists use nodules as the general term to describe a lump underneath the skin that at least 1 centimeter in size. So, yung abnormal tissue. Parehas na abnormal tissue siya ng ating vocal cords. Kung yun na damage, masisira yung ating pagsasalita. Vocal cord paralysis. Yung vocal cord na hindi na siya nagpa-function. Sa language impairment naman, ang mga causes niya ay family history of language disorder. So, namamana din siya. Premature birth, yung hindi sakto yung pagkakapanganak, low birth weight, pagkulang sa timbang ng isang bata, hearing loss, so meron din naka din pala siya, naka-connect siya, autism, thinking disability, genetic disorders such as Down syndrome, fetal alcohol spectrum disorder, stroke, brain injury, tumors, cerebral palsy, poor nutrition, failure to drive. So, kahit pala yung poor nutrition, yung hindi tamang pagkain natin ay nakaka-cause din pala ng language impairment. How speech disorder treated? Mild speech disorders may not require any treatment. In speech therapy, a professional therapist will guide you through exercise that work to strengthen the muscles in your face and throat. Some people with speech disorder experience nervousness, embarrassment, or depression. Talk therapy may be helpful in this situation. So, kung meron man tayong mga case ng speech disorder, kailangan lang natin parang ang treatment na kailangan natin, talk. Kausapin lang natin sila ng kausapin para malesen yung mga dinaramdam nila. Kasi sabi nga dito, yung may speech disorder, experience nervousness, kinakabahan sila, at kung kinakausap sila, kinakabahan sila, nahihiya din sila, tsaka nagkakos din siya ng depression. Kaya dapat hindi tayo yung magda-down sa kanila na ganon, yung may nararamdaman na sila, dinadown pa natin sila. Kailangan natin silang kausapin para mabuhayan sila ng loob na kaya nilang malampasan yung mga ganong mga bagay. So, how to cure language impairment naman? The common treatment for language impairment in speech and language therapy, treatment will depend on the age on your child and cause the extent of the condition. So, dito naman, parehas lang din siya doon sa sinabi ko sa speech disorder. Ito na yung additional information about speech and language impairment. Paano ba natin sila alagaan sa ating bahay? Working with your child at home can help. Here are some tips. So, ito yung mga tips na kailangan natin kung meron man tayong pasyente na meron speech and language impairment. Number 1, speak clearly, slowly, and concisely when asking your child a question. So, dahan-dahan tayo magsalita sa kanila. Dapat malinaw din para maintindihan nila yung mga sasabihin natin sa kanila. Kung magtatanong man tayo. Number 2, wait patiently as your child form a response. So, hindi dapat natin sila minamadali. Hintayin natin na mag-respond sila ng maayos para maintindihan din natin yung gusto nilang sabihin sa atin. Keep the atmosphere relaxed to reduce anxiety. So, dapat kalmado lang tayo. Hindi natin sila dapat i-pressure na pamadiliin, ganon. And number 4, ask your child to put your instruction in their own words after giving an explanation or command. So, bigyan din natin sila ng time na isulat yung binigay nating instruction sa kanila na kailangan ganto, ganyan, na hindi natin sila pinamamadali. So, maraming salamat sa pakikinig. Ako nga pala si Princess Jane Narciso, nagre-report sa speech and language impairment. Thank you!